really interesting question for you. How do you think the policies that were in place historically, um, that would have been centered around maternal and child health, how do you think that, and how they were administered back then, do you think that they are actually influencing how mothers are treated now? The fact that, you know, when we talk about breastfeeding, most people glaze over. It's not a sexy topic. The fact that getting breastfeeding in the workplace policy, although it is important, it's not something that we have. We can't get longer maternity leave. I know we talk about the government not having enough money, etc. But why is it that we have to kind of push really hard for what is really a mother's reproductive prerogative? Um, do you think that the policies before have influenced where we are right now in terms of those policies that we have now?
Um, frankly, I wouldn't say that Barbados is bad in terms of policy.
Better than some.
Better than a lot of places.
Mm-hmm.
I think we're better than the United States, and that we're probably just under maybe the Scandinavian countries that
Mm-hmm.
have such good,
Mm-hmm.
social welfare
Yeah.
networks and so on. Um, but I think because of the post emancipation period was so hard and so rough,
Mm-hmm.
coming up to say the 1930s and so on, that there has been a tremendous transformation in terms of decisions made to reverse the negatives of the past. If we take, for instance, the whole issue of bastardy illegitimacy,
Mm-hmm.
the state no longer recognizes that, or the church no longer recognizes that. All children are deemed as equal. There's no discrimination against children anymore. And most importantly, Barbados made a deliberate effort to put policies and systems in place to address high infant mortality. Maternal and child care, child health became very important in terms of developmental policy after into the 1950s and 1960s. So we have the establishment of several health centers around the country. We call them polyclinics now.
Yes.
You had organizations such as your own, the Baby League, and so on. So there was sort of like this urgency to address the negative policies of the past, to support mothers, provide them with antenatal clinics, provide nurses, provide trained midwives. So Barbados, because its health history was so bad in terms of maternal child health, addressed those issues head on to become a leader in terms of maternal and child health in Barbados.
And
so I think that in a way, a lot of the issues of the past have been addressed, where now Barbadian women have access to good health care. They don't have to pay. They can go to polyclinics and be monitored throughout their pregnancies. There is support after care at the same clinics and whatnot. So there's a tremendous amount of support. So I wouldn't say that the past has had a negative legacy. And I think in Barbados, people cherish their children in a way. Sometimes I wonder if it is not a legacy in the past itself, where the generation of my mother's generation, where people could talk about the children that they lost or were still born. So I think there is in Barbados an almost a very I think we treasure children.
What I liked about what you said is that sometimes if you don't know the history, it's hard to kind of
Yes.
understand and appreciate what you have, in the current situation that you have.
Yes.
So you see what I mean?
Yes.
So basically painting that picture for us that actually things were pretty horrid. Pretty horrid.
Pretty
And
horrid.
then Barbados, because of that challenge, Barbados stepped up and they
Barbados stepped up.
put those
And
policies in place.
with whatever they had, the feeding, and then when children went to work, went to school.
Yeah.
There was biscuits and milk.
This and
That
school
was
meals.
that,
Yeah.
and then later on,
The
school
school
meals,
Yeah.
and then they had school health,
Yeah.
where doctors would come into the schools
Mm-hmm.
and examine the children's teeth and eyes and the general health. And then you had these vaccination campaigns.
Yes.
I remember getting polio vaccine,
Yeah.
polio thing at school.
Yeah.
So Barbados said, look,
Mm-hmm.
we are going to address these issues that affect child health in Barbados. And I think we've built up a relatively good system. I think we have. I mean, within the modern context, because you see, we take for granted a lot of the things that we have.
Mm-hmm.
But we must remember that things like holiday with pay and maternity leave are
Yeah.
new,
Or new.
are really
Yeah.
historically new things that
Yeah.
only came, after the development of the welfare state in Britain. And therefore they became, and because of the workers unions and so on, advocacy for that. But these things in the developing world only became a reality maybe 4 or 5 decades ago. So the quest to even improve that will continue. In, I think, Scandinavian countries, and I think in Canada, you can get as much as 1 year's maternity leave.
Yes. Yeah.
So we have 3 months now. So paternity leave became an issue. Now we are moving toward toward a thing where Barbadian men could have paternity leave. So we're always, I think,
Striving. Yeah.
striving
To
to
improve and do
improve
better.
and to do better.
Yeah.
And I don't think that we've done badly.
Right. Okay. I love your response. And I think too that there's always a need to be questful. There's always a need to try and improve things. And I suppose that's why we're sitting here. That's why the Breastfeeding Child Nutrition Foundation exists at all. So yeah, I guess I understand your point, and I think what we probably need to do more often is maybe take a look back
Yes, and to see
where we've come from.
Yes.
And keep it in
Yes,
perspective.
yes.
Yeah.
I mean, I think we've done so tremendously well